I've been on the ministry line with people who've come up with back problems, and I've looked at their shoes and I've said, I think your problem's your shoes.
Hello and welcome to the Restore Healthcare Project. I'm Dr. Jennifer Kang. Thanks for being with us. I just want to remind you to like, follow, subscribe, give us that 5-star review. We love your comments and we love to respond. So engage with us. I'm here today with Paul Manwaring, nurse, church leader, my good friend, and we're here to explore another core value of dual realm healthcare. Welcome, Paul.
Yep, good to be with you again. And this is a good subject. This one.
This is one of your favorites, I think, or it could become a favorite just because of also your passion in healthcare. Let me read it, and then you can kind of give a little background to why you see this as an exciting one. So, core value number 7 seeks to always understand the interacting dynamics of emotional, spiritual, physical, and environmental causes of disease. Always endeavors to avoid exclusive approaches in pursuit of the unique remedy for each individual. I know your passion in healthcare, but tell us a little bit about your background that makes you interested and excited in this one.
To start with, I was a psychiatric and general nurse. So I trained in both and had a little bit of exposure to mental health issues. And then, of course, I joined the prison service, worked as a prison officer, and spent 20 years working in prison. And then I go become a professional, minister, church leader. And a lot of people say to me, "Oh, those are 3 very different careers," and I say, no, they're all the same. They're just about taking care of broken people, and I think different elements of brokenness. Obviously, the physical brokenness in healthcare, the mental brokenness in psychiatry. Many types of brokenness. If you go to prison, moral brokenness, the breakdown of relationships, of family, etc., etc. And then I think the real hope that Christianity and the church can be much more of a part of the solution in creating, the community. And so it interests me. It fascinates me. My desire and hope is that the church will become the beautiful bride of Christ that does provide health and wholeness in many, many different ways.
Yeah. Even currently in healthcare, the focus has shifted over the last decade or two from a very pronounced biomedical focus, and it's been criticized for hyper and over specialization, focusing on really the biomedical aspects of disease or dysfunction. And there's a shift of, wow, we've left some things behind, and there's other aspects contributing to and needed for health for individuals and communities. Why do you think that a narrow, exclusive perspective in any of these areas, biomedical, psychological, environmental, relational, why that doesn't fit with a dual realm view of healing?
It doesn't fit kind of almost in the two directions. If you draw the cross, it doesn't fit horizontally, and it doesn't fit vertically for me. It doesn't fit horizontally because, we are complex human beings, and all of us have an emotional, a spiritual, a physical, a relational, an environmental interaction. It's impossible to not interact in all those ways and more. And then I would say, vertically, it's very much that God is interested in every aspect of our lives, and actually our Bibles demonstrate that. And more than that, really, the dual realm, obviously we want to see people healed supernaturally, but we honor people being healed, physically. And so learning to fully embrace and access not just the spiritual solutions, not just the emotional solutions, but the God-given solutions to man. So to me, it's the whole picture. I mean, it's everything. It's like our life on earth should be the whole person. Our relationship with God should be the whole person.
Yeah. And I think it's interesting that the Bible has had wisdom for us on this for ages. And we feel like we're just discovering this. Oh, what do you know? Uh, Physical dysfunction is related to psychological and spiritual distress. And, in all fairness, great honor goes to the fields of psychiatry and psychology who have helped flesh this out for us and helped us gain understanding of these interacting variables and components that actually directly affect our physical health as well. Um, at the level of the soul and the mind, like, what is the biblical basis for this?
That's a huge, huge question in one go. But, you know, you, for me, you cannot separate biblically body, soul, spirit. You just cannot. And I think actually where I would come from on that, which you would probably expect, is that all three, in order to be healthy, need to be embraced in tension. That physically my body is healthy because of various tensions. Emotionally, I'm mentally healthy or mentally fit, which is my preferred phrase. And spiritually, I'm spiritually healthy when I'm able to embrace the tensions. So I think that's probably where I would start from. But there are a couple of interesting things I think that I'll just throw in. One of them is that God has a soul, which
Mm.
which might sound shocking, um, but I think part of the reason why we haven't fully embraced sort of mental health, as it were, and soul health as well in the churches, because I think we missed the fact that God has a soul. Because Psalm 16 says, my soul rejoices. And it's God speaking. And if the soul is mind, will, and emotions, God has a mind, he has a will, and he has emotions. So I think some of the reason why we've separated it off at times away from God and the church is because we miss the fact that actually God has a soul, God has emotions, God has a will, God has a mind. So that's a piece that I kind of come in there. I'm not sure I quite answered what you said, but that's where I'd start anyway.
Yeah. I think that's the basis for understanding the integration of who we are is looking to him and who he is.
Absolutely.
Huh.
There's a book some years ago I read, and it on I just remember the page. It's funny, and on page 55 it said, "As we have seen, the glory of God is displayed in His emotions." And the reality is, I've read that book, and they didn't mention it in the 55 pages coming up, but the point was so powerful. The glory of God is on display in His emotions. And of course, God's emotions are all happening all at the same time. They're more like a stack of pancakes, if you like. It's not like he has a happy day and a sad day and a mad day and an angry day. It's like they're there all the time. And so, therefore, the very health of God, it is his ability to hold all of these emotions together at the same time and to be responsible for his behavior, if you will, his continued expression towards mankind. So I think that there's so much for us to learn as human beings about how we manage our mental health, mental fitness, and manage our emotions. And I think, I think you said in the run up for a long time, we've been really nervous about psychiatry and psychology and mental health and mental illness in the church, and I'm so glad that that's rapidly changing.
Yeah.
And I guess in a way it's the core value. The core value for me is really about it's losing the us and them. That's what this core value is about. And so it's about losing the us and them between specialists or between disciplines and starting to learn how they connect together. And of course, that for you and I would be not just, mental and physical disciplines, but it would be the spiritual disciplines. It would be, areas of just health and hygiene and lifestyle and environment and family and relationships, and they all go together.
Yeah.
And the biblical view is that healthy, whole people are healthy in all of those areas of life. And
Mm.
that's where health comes from.
Yeah. I mean, I think it's something that we are now realizing is the next elevation of discovery and breakthrough in bringing health is that, okay, so we have developed breakthrough in treating heart disease at the time that it presents. We've got treatments for the acute in ways no one could have ever imagined what we're now capable of doing. But then we back it up to why did we get here? How did we get here? How did this dysfunction result? And the biomedical perspective would have said, oh, it's due to diet, it's due to exercise, it's due to genetics. And research has now shown it's more complicated than that. It's what you're referring to. And it's trendy for good reason to talk about things like ACEs, adverse childhood experiences of abuse and neglect, of emotional and psychological abuse and neglect that result in adult onset disease. We now have amazing data, which is still hard to understand how those dots connect physiologically. We're still working that out. But it's what you're referring to. There's such an interplay between the aspects of our being and our environment that we haven't yet understood. Scripture tells us, has always told us that this is present, but we are just now starting to value it and starting to try to understand it. How can a dual realm perspective help us as we're even learning this in our own age? How to make sense of this? That, in fact, there are tensions between our soul, our mind, and our body that create some of this.
Yeah, I mean, I think that learning, from if we let's take this simple thing about, say, the Sabbath and a sabbatical lifestyle, and a lifestyle that actually honors heaven's approach to life on earth of how we should live. And this Sabbath model of the two models of Sabbath I understand in the Bible, that we rest from consumerism and work, and we sort of rest out of the celebration of our success and the fruits of our labor, and that's biblical. And so now we live in a world where it's really hard to find that.
Yeah.
And so dual realm for me is going, okay, how do we access the principles of heaven that were woven into mankind at creation, and through, of course, the years that our Bible covers. So I think it would be that it would be looking at the principles that are in life. One of the things I noticed recently is that the Ten Commandments are not to make sure we don't do wrong. They're to keep us out of lack.
Yeah.
That when we break those rules, we enter into lack. And lack is what we're talking about. It's lack of emotional, spiritual, physical, and relational health. So I think another interesting one. I almost wonder whether what you're looking at here with the ACEs is now, but I wonder whether there'll be an equivalent word or set of letters in 10 years' time to do with the effect of the smartphone on people.
Yes.
And because that's huge. I mean, I was with a wonderful man yesterday. His 12-year-old daughter has really terrible OCD, and I find myself just wondering, now, this is a beautiful family, healthy, loving, caring Christian family, and here's this challenge. What's causing that? What disturbance in the rhythm of man's life on earth is causing us to have an increase of OCD in children, young people, which I guess is very much what you're talking about, the connections, the correlation between what happens to us in life and later on in life, physical conditions.
Yeah. Hey, Healthcare Tribe, I hope that you have been impacted by what I've brought through this podcast. I also want you to know about opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org. I think that, we can also go down the path of discussing or contemplating the correlation between spiritual distress and the manifestation in the emotional, psychological, and physical realm of a person. I know that to some degree that can cause a little bit of nervousness in my very biomedical colleagues who I think probably react to some of our own history in the church or in other religious practices of superstition about spiritual causes of disease that we now feel that we have fairly adequate biomedical explanations of. For example, epilepsy for eons was considered to be a manifestation of demons. Now, you and I do believe that demons exist and the angelic exists, but not all seizures are caused by demons. Maybe some. What do you think about that? The interplay with dark spiritual power and our physical and emotional health.
Yeah, I mean, that's when you think of, let's take the area of mental health. So the problem, I think, is that what we have tended is to just divide up into disciplines. So you might, you've got those that think it's demonic, you've got those that think it's organic, you've got those that think it's, environmental, and so it's almost like being treated in those separate entities. And so you end up with the church can very easily end up with the sort of the exorcism route, and therefore it's rejected the medical route. And so until recently, people were very cautious about letting anybody in the church know that they were taking any form of, antidepressant or, psychiatric related medication. So it's good that we're breaking some of that, but I think that some of it has come because we did divide. And so what we need is we need discernment. We need to recognize, is this the devil? Is this, is this environment? Is this just the sickness caused by sin? Is it even just the stress of life on earth? So I think we need discernment more than ever. And I think you said in the last podcast we were doing, there's so much judgment in the world, and we need to lose that. I mean, myself, you know quite a bit about different parts of my story, but in the last 2 or 3 years, I found myself involved in one of the most difficult organizational situations of my life. Bearing in mind, I've run a prison and been a riot commander, and this was, a couple of leaders in a church, not Bethel, and Stace to add. And long story short, ended up, it got to me. I mean, it was affecting my sleep because I was dealing with people in another country. I was doing emails late at night. I was aware of everything, and I started to develop gastrointestinal problems. And I started to see this connection between the two, and this vicious circle that was happening. And fortunately, I managed to find a way out of it. But I did stand looking out of the window in the Norwegian fjords, and I've said to people, I saw a corridor and it said burnout above it, but I didn't know where it went. I mean, it was as simple as that. I knew I could walk down the door. I knew I could hold my head up. Nobody would say, "Gosh, Paul's weak." No, I was in the middle of it. So I think that we need discernment, and alongside that, for me, the greatest need for not just church leaders, but I think anybody who is caring for human beings, working in an organization caring for human beings, one of the greatest needs in our world today is friends.
Yes.
Real, genuine, accountable friends.
And really approaching it with tremendous humility. It may be not just this, right? It may not just be one exclusive thing that's causing distress. And I think the humility to recognize what part I can minister to and what part you can minister to. Um, Not all distress is caused by, I know we like to have it boxed up and pretty and neat that, oh, this is due to unforgiveness. And that's it. And all you need to do is forgive, and then everything's fine. And and certainly there's components of that. But I will say, as a practicing physician for 15 years, it's not always that straightforward. And there are components that I am so grateful to have the help of the Holy Spirit to navigate through with my patients and to recognize, okay, there is this emotional component, there is this spiritual component where forgiveness is needed. That's the treatment. But also at the same time, there's this organic thing that's happening, and that's best treated with surgery. And we actually get the joy to explore the complexity of humans made in the image of God with this complexity of interplay.
Yeah, and I think medicine and healthcare is one of the great examples um, of, there are people who do an incredible job of, sitting with a patient and taking not, the physical history, the family history, but also taking, the spiritual history. I know some physicians who do that. So I think absolutely what you're saying. Wouldn't it be incredible if, with complex patients, there really were genuine sort of case conferences where you'd have all the disciplines represented and, a prophet in the room, somebody with a word of knowledge, somebody who really just knows the presence of God. And, you know, I mean, I think in a way, not bigging you up too much, but you are that because you do have such a vast way of looking at the world and of people and problems and illness and what have you.
Yeah.
But yeah.
I mean, I would say that that is one of my big dreams. And I think that I try to do that on a fairly small scale in my group practice. But that is not an uncommon kind of scenario in our practice that the physicians and clinicians that I work with and our support staff and our therapists, we actually do discuss some of our patients' cases together and we pray. We ask for wisdom, and some of us might get a word of knowledge for something, and I've seen it happen over and over again. Like, actually, I have this sense, I have this picture, and that is also a non-exclusive way to approach healing, is actually the togetherness of the healthcare community. And it's my dream that that would be something we see more in healthcare, that we see grand rounds where cases are presented and people with spiritual giftings also have freedom to use their spiritual giftings to bring insight in the same kind of conversation that we would have generally in a biomedical case conference. That's, I think, possible. I think it's with insight.
Yeah, I would suspect that definitely the area of mental health, that would be an incredible development as well, if that were possible.
Mm.
Uh, I know that does happen. And, when I think back to my, very primitive psychiatric nursing days, there was a sense of bringing in, many disciplines to work together, the occupational therapists, the art therapists, that. So there was more of that. But I think there's more of that to discover.
Mm.
And I mean, I suspect, it's interesting, isn't it? So the development of, as it were, the specialisms has got to a point, and what you're now, I think, saying is those specialisms need to find each other in humility and really learn to honor that, and then bringing into that dual realm would bring in the spiritual component uh, and those who know how to discern and hear God as well.
Yeah.
That's an incredible vision. That's the dual realm healthcare practice of Dr. Jen Kang right there.
Oh. I actually even think Paul, the Apostle Paul, gives us a model for this when he talks about the body of Christ being a body. And even the way that the body functions, each part has its own very specialized function. within the body, but the hand can't say to the foot, I don't need you. And, amongst specialties, we have this running joke that, our area of the body is the most critical area of the body that we care for. And I have this running joke with a cardiac surgeon that I work with that, clearly the heart exists in order to provide blood for the uterus, which provides life for all generations. So clearly cardiology exists for obstetrics' sake. And,
Yeah.
and of course he thinks the heart is, the body cannot live without the heart. So that's the most important. But really, the Apostle Paul talked about none of the body parts can actually function well separate from each other. And I think that us and them that we talk about in healthcare, we see that tension at present. We see biomedically trained physicians critically judging the naturopathic clinicians. We see the chiropractors judging the biomedical physicians. We see the functional medicine physicians accusing biomedical physicians of not trying to get to the root cause of disease and not caring about the environmental and community and lifestyle aspects of health. And instead of focusing on what we each bring in in our specialized function, that is power, that is gift, and running in that lane well, and embracing the fact that I need you and you need me. Like, get out of accusation mode and back and get rid of the us and them. We would actually see that perhaps God has already provided for us all the components of a really amazing multidisciplinary approach to health that, if working together, would actually get people whole.
Yeah, and it's Paul again. He said, "From whom the whole body fitted together by that which every joint supplies." It's actually the definition of, as I understand it, efficiency, because it's if everything's fitted together, the energy that you invest ends up in being, which I think is that how you measure coefficiency. I think something along those lines. So Paul actually is describing efficiency in the body, but then he says, and then he says the building up of itself in love. But in 1 Corinthians 12:31, he says, I'll show you a more excellent way. And he gives us 1 Corinthians 13. Is it possible that actually the definition of excellence is everything working together by that which every joint supplies? Is that what excellence looks like? Is excellence in healthcare everyone working together? And the excellence isn't performance or perfectionism, but excellence is that we are drawn to excellence, not driven like we are to perfection, and that we're drawn, and that the excellence has this drawing on all of the disciplines and causes us to want to work together. It seems until recently that, that the dietitian in a hospital, just made sure that the diabetics had the right meal at lunchtime. That's what it felt like to me when I was a nurse.
Yes.
And now it's kind of like, no, we can actually help you be healthy. We can cure you. We can prevent disease by you eating better.
Mm. And I just think this open-heartedness that we're talking about, where there's no one exclusive approach, and that I'm able to say, I need you. I need you to come alongside and bring what you bring. And I am not the only answer to this. It also distributes the weight. We see clinicians and healthcare providers just burned out with the weight of responsibility that our societies are placing on them to fix people. But we carry that weight together so much better. And I think it's amazing that you identified that as excellence, the efficiency and collaboration is really key to that.
There's this incredible story, and I get the detail wrong. Spiritual son of mine had an emergency gallbladder removal, and the anaesthetist that did it kind of got to know them a little bit, and there was this sort of connection. Well, within 4 weeks, my spiritual son's wife is having a baby, and it was drawn out long. Who ends up being the on-call anesthetist, is the same lady who came in and she said, I have never treated a husband and wife. This is my first ever time. And so she looked after the, the anesthetics and what have you. And then she came back, and because the daughter, the girl, German, mother in another country, this anesthetist stepped in like a mum in the delivery suite and stayed on. And I'm like, that's what you're talking about. It's like, it's not about, that's my discipline, I don't touch that. It's that here's a patient, here's an opportunity for me to be the best me I can possibly be, and work alongside other people and bring out a beautiful, healthy baby.
Mm, wow.
And I butchered the story. It's better than that.
But it does highlight and illustrate beautifully this concert that actually you believe God has drawn us into. He's given us the opportunity to sit and play in this concert that he wrote the music for. Very beautiful. So we believe
I
best
had another
healthcare.
funny testimony just I was given a prophetic word, and I'm still believing for it, that I will see cancer healed in the last days of somebody's life. But because of that, the next day after the word, I still have them. I had some cowboy boots, and they were given to me when I had prostate cancer for crushing cancer. And so I said to my wife, I've got this prophetic word. I'm going to wear those cowboy boots. Well, I had low back pain, sciatic problems. I had some cramps in my feet, and basically my legs just ached all the time. But I knew it wasn't vascular. I wore those cowboy boots the next day. I wore them for a 14-hour day, ministered all day on my feet, got home, and my feet are completely cured. I have never had a problem since, because I never buy cheap shoes ever again that don't have good arch support. Now, I don't know how you fit that into what we're saying, except I had a prophetic word. I applied it to my life with a prophetic symbol, a pair of boots. But the pair of boots had better arch support than my shoes I'd been wearing, and it healed a physical problem. I've been on the ministry line with people who've come up with back problems, and I've looked at their shoes and I've said, I think your problem's your shoes.
The wisdom of God makes us all just shake our heads. And again, it's so true. He doesn't separate it out. And we shouldn't either. We have this privilege of being able to function and discover with him that people are whole and their parts he knows how to address, and he can lead us to healing.
Yeah, and we need to train. One of the tragedies is, definitely in this country, the hospital chaplain is fairly low down the pecking order of jobs that you would want when you've trained as an Anglican priest, vicar, whatever. You've kind of got you've got the big jobs and the big churches, and then you've got the little parishes, and then somewhere along beneath that, you've got prison chaplains and hospital chaplains and industrial chaplains. And we need to get the hospital chaplains. We need to get the very best in there, so that they can really become like the best in their craft, their skill, and not just be comforting the dying, but helping, with relational, spiritual, emotional health alongside the surgeons and physicians.
I think that takes us recognizing in each other what we each have been designed to carry, and functioning as a whole with honor, with humility. This has been a really fun conversation, Paul. Thank you for helping us navigate kingdom perspective of whole person care.
My absolute pleasure. I'm always nervous that I've probably gone off in another direction, but I had fun, so.
We always do. Thanks for joining us and having fun with us. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.